Hi everyone, welcome to my dental health webinar. My name is Heather Harris Capola, and I'm going to be going over some important facts, resources, statistics, and activities that we can incorporate into our daycare centers and homes. And even if you're a parent and are watching this video, this is just a great way to kind of figure out what to look for, how to do screenings, and just how to make oral and dental health just fun. So that is a thing. We can do that. So I'm just going to share my screen. I made a PowerPoint. So I'm just going to pull that up for you all so we can go through it. We move this down and I'm just going to start this. Okay, perfect. So dental health. So when we talk about having dental health in our center, we have a lot of kids filtering in, right? We have, if you're a home daycare, you have usually 9 children, and then if you're a center, sometimes you can have up to 20 in your classroom. So just like kind of thinking about just dental awareness. How do we know, especially now that it's been COVID, most centers and most daycare homes are not brushing teeth. And that's okay. And some daycare homes choose just not to brush teeth. And that's okay. There are different ways that you can incorporate oral health into your classroom without actually brushing the teeth. And the importance of it, we're going to get into, but I just want to let you know that the more education and awareness we have, and I'm going to provide that too as we move through the slides, the healthier our children are going to be. And it's so impactful with the amount of children that you all see a day, a year, and as the years move on, how this all adds up. So I just really want you to kind of keep that in the back of your mind as you start moving through these slides. And think about your children, think about what you've seen so far. I know in my time of 10 plus years being an early Head Start and Head Start, what I have seen and what I have experienced, and I'm sure you have as well. So sometimes you just need to like brush up and kind of think about how can we improve this? How can we make this better? And just kind of knowing simply like why dental health is so important. Dental health is, if you're going every 6 months, that's preventative health. Okay. So this is an indicator of your overall health. When we're looking at our lower income families who are coming into our daycare homes and centers, we have to really think about, okay, they're at even higher risk for dental concerns because they usually do not have a dental home for their children. Transportation, all kinds of barriers and challenges that will prevent them, even phobias of going to the dentist. And, when you think about children who are having any kind of dental issue, they have, pain, the infection, or tooth loss. If you're missing a tooth way early on, children get very sensitive about that. They don't want to smile. They are insecure about that. If you have pain or infection, how does that affect a child's day? How does it affect your day if you have any kind of pain in your mouth? That child's not going to be wanting to eat. They're going to have poor nutrition. They are going to not be able to concentrate. They may exhibit behaviors, crying, they're upset. There's no way that they're going to be able to concentrate in a class with that kind of situation. So just kind of keeping that in mind, if we can prevent any of these things from happening, we're going to be way better off. And again, setting that foundation early on and building those good habits are going to, go on with them into adulthood, preventing a lot of other health concerns, which I'll talk about soon. But also, if we are consistently talking about dental health and having activities and sending things homes, talking to parents, we are, for one, going to have good relationships, but we are going to have, those children are going to be wanting to do these things at their home. They're going to be teaching their siblings, teaching their parents, and that's what we want, right? So we're looking at common dental concerns. And so right here, I just wanted to post this picture. It's right on top of a before and after of a child who clearly neglected their teeth. Okay, they have dental caries. Their teeth are a little bit, discolored. Well, I would say a little bit. They're a lot of bit discolored, and so obviously after the dentist, they cleaned them all up, and they're much better. I don't know if there needed to be any extra dental work after this or some sort of surgery, but they're much better afterwards. So we want to prevent the before picture from ever happening. That is our number one goal. So when we talk about the common dental concerns that we are most likely going to see in our daycare homes or centers is tooth decay. People call them cavities, dental caries. That's something that you can sometimes just screen. So if you're actually do participate in toothbrushing in your classroom, putting on gloves and just lifting up the lip will reveal a lot. If you could see some of this decay, you can see. I don't know if anyone's ever seen the grayed out teeth. I've 100% seen that. You can see red gums. You can see irritations. You can see a lot of things, especially if you're looking at the gums. If there's any kind of abscess or anything. So let's not, even if you're not brushing teeth and you're feeling like there is some sort of, children are like grabbing their face or they're not feeling well, you can always put on some gloves and lift up and see if you see anything. But just being aware that that could be part of the reason the child's not feeling well. Tooth sensitivity is also very common if there's any kind of issue, and when children drink things, they may complain of, my teeth hurt, my teeth hurt. It could be some sort of, or could be sensitivity with their gums or teeth. Dental emergencies happen. So let's just say there was some sort of dental emergency where, like, there was an abscess or an infection, something major happened, a trauma to a child's teeth. It is not always the easiest to get a pediatric dentist to do the work on that tooth. It could take months. Sometimes they might have to give medications and just get it under control before the actual dental surgery is able to happen. So keep that in mind. That anything preventative is going to really be beneficial. Pediatric gingivitis and gum disease is a thing in early childhood. I honestly, for the longest time, would have thought that that was only for adults, but it's not. If children are not brushing their teeth regularly and are having lots of sugary foods and soda and things like that, that is, or and not even floss and not flossing. Flossing is a huge one. Flossing daily, they are at high risk for pediatric gingivitis. Orthodontic problems. I always say, like, our teeth are like placeholders for our baby teeth, the placeholders for our adult teeth. So if we're not taking care of those and the children are thumb sucking, they are at risk of having those teeth move and not come down straight, which again, we have to get those expensive braces and things like that. So just being aware that orthodontic problems can be addressed, early on with proper dental care. And then dental anxiety and phobias we can also address in the classroom, because these are things that aren't just child driven. Adults, their parents may have issues and dental anxiety and phobia about the dentist because they had a bad experience. So we want to make sure that, how do we have that conversation? How can we make that easier for them and even find out? So we'll talk about that a little more, how we open up those conversations and get down to the core of it so these children are able to get to the dentist when they're supposed to. So here are just some dental health facts. So I just pulled this American Dental Association. Um, when we're talking about emergency room visits and how they can be prevented with regular dental visits. So nobody wants to have to go to the emergency room with any kind of dental concerns. When you have to wait a very long time, it's a lot of money. You don't always even get, the situation rectified right away. So prevention is the best thing. And the way that you do that is by going to the dentist, not every year, not every 2 years, but every 6 months. You can find out a lot in 6 months, and your teeth change a lot in 6 months. So just keeping that in mind. I know if I don't go to the dentist in a year, it is not a good situation. They're scraping extra. It's my teeth look very colored, and I would say discolored. So there's a lot that happens in 6 months, and especially as you get older. We want to make sure that they are going regularly, have those appointments. Poor oral health has been linked to several heart issues, including heart disease. So we're just going to talk about the plaque on your teeth. When you're swallowing and you have a lot of plaque on your teeth, that goes through your system and that can start attaching to your arteries, causing heart disease. So we're talking, even moving further, about chronic inflammation from gum disease and how that raises cholesterol levels. Wasn't even aware that that was even a thing, but it makes sense, right? If you have inflammation, if you have plaque, you're going to have issues. It could be very much related to your heart. And then even having any kind of bacteria infection in your mouth, how that goes through your bloodstream and can affect your heart valves. And then also talking about how gum disease appears to be more frequent in severe diabetics. Diabetes is huge. It's especially huge as you get older in life, and aren't making proper choices with your food and exercise and things like that when we're talking about type 2 diabetes. But if you're not managing your blood sugars and living a healthier lifestyle, it's all kind of related, right? So if we're eating healthier foods, our fruits, our vegetables, taking care of our teeth, we are going to also be healthier, not just have good oral health, but have good physical health as well. So just keeping that in mind that it is dental health is part of your overall health in a lot of ways. So I pulled out these statistics from the CDC that I thought were very interesting. And I hope you find it interesting as well. But when we're looking at children, ages about 1 out of 5 children, ages 5 to 11. So again, we generally care for children who are a little bit younger than that. But think about it. Once they turn 5, at least one child it has untreated tooth decay. At least one. Now think about your center. Think about your classroom. And usually have between, it could be 9 children if you're home daycare usually, and I think up to like 20 in a classroom if you're a center daycare. Well, that's a lot of children. Now, we move down a little bit further to the last little clip here. It says children aged 5 to 19 of low income families are twice as likely um, than higher income families to have cavities. Okay, that's a lot of what we serve. That's 2 times as many. So think about just like in your day, how much, your education and screening of just like paying attention really matters when it comes to these children's overall health. So keeping that in mind, and then of course, 1 of 7 of adolescents 12 to 19 have at least one untreated decayed tooth. So those are very interesting statistics, and it just goes to show that we can be very impactful with what we do when we care for these children coming into our home daycares and centers. And I wanted to talk about baby teeth because this is always such a topic where I feel like there's a lot of misconception. Baby teeth are so important. And I feel that so many people think, okay, because they're just going to fall out anyway, they're really just no big deal. But they are the biggest deal because not only are they, nice for smiling, we all want to smile and have beautiful teeth, builds our confidence and makes us feel good. We use those teeth for eating. We use those teeth for talking. If you don't have teeth, you hear the lisps and things like that. Um, and they are placeholders. So we want to keep those baby teeth as healthy as possible. So those adult teeth come down straight and beautiful and healthy without any sort of issues. When we talk about baby teeth, they start coming out 6 months to 2.5 years old. As soon as that first tooth comes out, those children need to be at that dentist. And that's for a couple of reasons. It's good for them to just go and get used to it and get familiar and feel comfortable. And you never want, and I always think of this, if you wait too long and those children have like the cavities and or any sort of issue where they need to have like a surgery, or if that's their first experience at the dentist, are they going to want to go back? No. And are the parents going to want to take them back? Probably not. It's going to make them even more fearful. So just getting those positive experiences under the belt are going to be life changing. So get them in early, get those teeth treated early. You can find out if things are going on earlier on that need to be corrected or looked out for. And then also, just establishing a healthy mouth is going to carry on later in life. It just does. So we want to make sure we take care of those teeth. So I have choose water on here. This is, I feel, super important because if this is your beverage of choice in between meals, it's good for a couple things. It's good for your oral health, yes, because tap water does have fluoride in it, which is a natural mineral that prevents cavities. But it also does not have any sugar. It does not have any calories. and it's actually thirst quenching, where if you have juice, which has sodium and sugar, or if you have soda, which is usually sugar and um, sodium as well, they're going to make you more thirsty. You're going to drink more, you're going to get more cavities, and you're also going to have more calories, and it could lead to childhood obesity. So, keeping that in mind, that soda does attack the teeth. That acid in the soda will cause cavities. It will decrease the enamel, which is your protectant on your teeth. So, that's not a good choice. Juice, I know people like to give juice. If you're going to give juice, I would always say water it down. That cuts the sugar down, but then also have them, if you're going to do juice, either have them brush their teeth. If you don't do the brushing teeth, have them swish with water, but still there's no reason for it, so I wouldn't give it. Milk is always good. Milk does contain sugar, but milk during meals is completely okay. I would still say have them swish with water. That's just my little tip afterwards. Always make water available, and especially if we do toothbrushing in the centers or daycare homes, brush those teeth after breakfast and after lunch. I think is just the best way to go, and a great practice to start. And then that's already 2 times that they've already brushed their teeth. And then we're just hoping that the parents do it, at nighttime. When we talk about breastfed babies or babies who are bottle fed with milk or formula, you do not want to keep those babies laying in bed with that, because what happens is the sugar in that is going to break down the teeth and it's going to cause cavities. So I would always say, if you're going to do any kind of soothing feeding, definitely keep the milk for the meals, not for bedtime. Um, so just water for that if they're even old enough. Most of the time it's a choking hazard anyway, just to prop a baby. You never want to prop the bottle up anyway, but if you're going to be giving you know, any kind of anything before bed and you're not going to be brushing teeth, have it be water. So just to mention that, and then encourage drinking throughout the day. So in between meals, it's like great to have like little water stations set up, or have the children have labeled water bottles that they can just go and grab out of the refrigerator anytime, and just kind of establish that as good practice and encourage how wonderful that is and that they know they're making a great choice. Limiting the unhealthy foods. Many of us talk about this during, nutrition conversations and activities and things like that. We're looking at the sugar-based foods. So those starchy foods, the crackers, the dried fruits, the chips, the cookies, soda, juice, basically the junk. These unhealthy foods, they create acid and they attack the teeth. So think about that. Like, do we want to provide our children with foods that are going to attack their teeth? Probably not. We don't want to we don't want to be the cause of these things. And if we do give these things in moderation, of course, it's absolutely fine. We just want to make sure that we are doing the right things by having them either brush their teeth after their meals or swish with water. And then just limiting unhealthy foods for special occasions. A lot of us do non-food celebrations, which are great. But you can also if you do food celebrations, just make sure that they're healthier choices. So when we talk about the dental visit, what are they doing with these little kids so early? They're so little, what's going on? Well, they're doing lots of things. They can apply fluoride to the teeth, take x-rays, they fix cavities, just doing the dental screenings and making sure everything is okay. Um, Catching those early on. If you have a cavity that's just been sitting for a long time and not being taken care of, it can abscess, it can get infected. Look where our teeth are. They're right near our brain. That can affect our brain. That can affect when we're talking about the plaque on our teeth. We mentioned heart disease and things like that. It is just not good. So it is just better to just get these children there at least by their first birthday, when that first tooth cuts, and let's just try to prevent these things from ever happening. Get those fluoride varnishes to strengthen those teeth. I remember back when I was younger, I would have sealants and they put them on my molars. I think I had them for like years and years and years. And as soon as I went to high school, I think they fell off. And that's when I got my first cavity. I'm telling you right now, I think I only had like two, but it was, oh, I miss those sealants. They really do. They really do help those fluoride treatments. So they do put that on, especially early on, just to prevent. And then, a lot of times we were talking about the children being fearful and their parents being fearful, that is a thing. We want to make sure, what can we do to help them get over that? What do we need to talk to them about? How can we enforce how important this is? And then also their needs as well. So we can talk about that a little bit more, because we want to offer that support the best that we can, because it isn't easy. It's not always easy to even get to an appointment. You might have other kids. There's a lot of factors that come into play when it comes to these things. So moving forward, I just want to talk about, so I love a lot of these activities I'm going to be going over are from Cavity Free Kids. So I have all these links in my resource section that's at the last slide of this PowerPoint presentation that I think are going to be so helpful, and I think you're all going to love. But I did a Cavity Free Kids training, and I thought it was just eye opening. There are so many things that you can just click on. You can go right to their website and pull off like different resources, things to talk about, things that you can give to the parents, and things that you can do in every center of your classroom. It's fantastic. So right here, we're just talking about setting up your classroom. So like I said, there's just different ways you can incorporate dental health without actually brushing teeth. If that's, brushing teeth is great, but if you can't do it, this is what you can do. You can decorate your bulletin board with pictures of dental tools that children may see from the dentist, just so they are familiar. Because it's kind of scary when they're sticking metal into your mouth and you're not 100% sure what that is. So what is that? How can we get them to understand what that is and to not be afraid of it? Hang a chart in the classroom called "I had a dental checkup," and create a thermometer with a visual of the children who get their dental checkups. And this is a great way to be able to talk to the parents. So you are going to say, hey, like, look, we're doing this really neat little thermometer thing. We're celebrating the children going to the dentist. When is your appointment? We're going to put it up on the wall. And they may open up at that point and say, oh, my child's too young. They're two. They don't need to go to the dentist. Or, oh, I don't know, it's really scary, or I don't have transportation, or whatever it may be. That is your way of getting into talking to them about whatever it is. So you can squash it and then help support them through it. Give them whatever resources they need, and then the support that they really desire. So keep that in mind. That's how you can do that. Set up a pretend dental office and dramatic play. So when we do this, when we set this all up by putting, toothbrushes and little drapes and little things, little dental chair, it's not for the children to do this on other children, because that's very germy and not a good idea. But it's for them to do it on like dolls, little play dolls and things like that, so they can just feel, comfortable with it. And everything, you can go in there and you can ask them questions about it and talk about feelings and all that good stuff that we love so much. So again, with dramatic play, there's so much you can do with dramatic play, but printing germs on stage is a little activity. I have like some templates. I'll show you where those are, where you can print that right off Cavity Free Kids, just some germs. The kids can color them. You can put them on popsicle sticks. You can do cardboard boxes or tables for the stage. You can do finger puppets. You can use socks. You can use cloth. You can use all kinds of things to be able to create this. Have the toothbrushes in there, some play food, some signs, tickets, or programs that you'd like to, if you're doing some play acting, if you want to take it to like another level, you can do that. It's all lots of fun. You can use, I always say, just your imagination and creativity and whatever it is that you have to make this happen. So I'll show you again that link if you want to kind of set that up. Sand play is another little center where you can create some fun activities with teeth, and you can make your own. If you have things that you can buy that look like teeth, that's fine too. Just don't want it to be anything that they could choke on. But using a white egg carton and just kind of cutting it up so that those pieces look like teeth, and having like paper cups or plastic cups. You can number them, you can put letters on them. So it could be like a multi activity. But you can hide and bury the teeth into the sand, and you can ask. There's a couple questions on here that you can ask, like how many teeth did you find? Do you think we have that many? You have that many teeth in your mouth? How many do you think you'll find? Why do you think? Why do you think that? Just kind of having this conversation, so you're not only incorporating, you can incorporate the numbers, you can incorporate, the dental health, but you're also like doing that higher order thinking. So it's all kind of like a win-win with that. Science is also fun. So making the ice cubes, you get salt, food coloring, and you're basically just going to sprinkle the salt on top of the ice cubes. Encourage the children to just squeeze a drop of the food coloring on top of the ice cube and watch for the holes to form. So the holes to form are essentially the cavities, the ice are the teeth, and you're can talk about how like those germs and sugar and all that attack the teeth. So it's a great visual, and we love doing science activities, so it's a lot of fun. This was a cute song that I also found on Cavity Free Kids. Brush, brush, brush your teeth. You can sing this song to row, row, row your boat. If you don't know that, you can YouTube that. I would sing it to you, but I feel like you're not going to love me if I do. So, this is a fun little song you can sing while you're in circle time, while you're either brushing teeth or brushing like maybe a like stuffed animal's teeth. I know that we have those. Sometimes we have like fake teeth, or we have like those puppets with like their dinosaur puppets or fish puppets actually have the teeth. This is like a fun song to do while the children are practicing in circle time. So just different ways to incorporate all that. So this is my resource page that I was talking about. And I just wanted to say the first little line here, that's the Cavity Free Kids. If you can, I don't think you can click directly on here, but you can just Google Cavity Free Kids and the entire curriculum can come up, the stuff that I was talking about, and then also resources for the parents if there's anything that you want to talk to the parents about, and then other ways to incorporate these activities into your classroom. I also have this other link on here for some activities. It's a governmental website. Colgate has some that's on here. The CDC, I thought, had some really, really awesome printouts. So you print them out. They're all kinds of little oral health activities. And these would be the things that you would have the children do in art class. And they could post on bulletins. They can send them home. So I thought it's in Spanish and English. So make sure you check out those links. Those are on here. And then I also incorporated a YouTube because I love my YouTubes. So this YouTube is great. It's a dental hygienist who actually has the fake teeth and would go through and just, I think it's like 3 or 4 minutes, really easy, how to go about teaching children to brush their teeth and how to get them to practice doing it the right way, which I thought was really helpful because I was taught to do it the wrong way growing up, and I like ripped off like practically my gums. So it needs to be done the right way. I just hope this was very helpful for you. Thank you all for joining me today. If you have any questions, you can email them to me. I believe Emily has my information. I will be happy to help you out in any other way that you need. But everyone have a beautiful day, and thank you so much again.